I designed an NHS applied system dynamics learning tool. So the general idea for this learning tool is it was sort of more applied for integrated care systems. So I just wanted to give a brief overview of what integrated care systems are. I'm sure a lot of you are very familiar with it, but just so you've kind of got the general picture in your head and sort of why we chose to go down this route. So integrated care systems were established across the UK, and they were designed to sort of help promote more collaborative working across healthcare services and providers across larger regions of the UK. And I just wanted to give a brief overview of the aims. So this was to improve outcomes in population health and healthcare, to tackle inequalities in outcome, experience and access, to enhance productivity and value for money, and to help the NHS support broader social and economic development. Now, decision makers in integrated care systems are making changes and implementing policies at probably more higher level of decision making compared to maybe at more operational level, where sort of more like lower level decisions being made in, for example, trust or in a provider or service itself. So this kind of makes these decisions that we are making at this level to have sort of more of a wider impact across the whole system as a whole. And therefore, to ensure that the best solution is being carried out, it's important to maybe consider using modelling techniques to sort of help inform more evidence-based decisions. So one of the reasons why this is a very crucial thing to sort of consider is basically a lot of services and providers are very sort of interconnected across all of these systems. Now, the reason this is something you want to consider is, for example, if an issue arose in acute services, and then you put a very reasonable solution to sort of overcome that solution. Maybe it's not, completely resolved, but it's better than it was. Now, sometimes because of how interconnected things are, this could actually result in more issues arising in the acute service itself. Or it could maybe result in issues arising in services that are sort of either directly or maybe indirectly linked to this provider, depending on the solution. Therefore, it is important that we sort of understand how connected our services and providers are across our system, as actually these connections can sort of impact the outcome from a decision that you may have put in place. So this is what System Dynamics offers. So System Dynamics essentially allows you to sort of consider all the interactions across the system independently, and then you can create this model by those independent sort of interactions across services and providers. And then you can sort of see an impact that a combination of these interactions can have across the whole system. And this sort of allows you as individuals to grasp the impact a decision can have. And it also allows you to sort of try alternative scenarios for a policy you want to implement, and try and identify a potential solution that hopefully would sort of minimise the amount of these, what I've deemed as unintended consequences, but I'll get into that a bit later. So why develop a system dynamic learning tool? So overall, I wanted to develop something that could encourage sort of mid to senior level integrated care system managers to use system dynamic models to help inform their decision making, but also it is just a great way to communicate across the what system dynamics is. So, for example, there are loads of different forms of engagement. You've had a various of presentations today, for example. You've also maybe been exposed to case studies, but having sort of a learning tool, which is something that sort of more engrosses active learning, which is something that adults in general tend to learn better from. We thought it'd be a good idea to sort of create a learning tool that sort of targets that and sort of trial and see how that lands. So elements I want to incorporate into the learning tool. So firstly, system dynamics is very technical. It's a very complicated topic to sort of grasp. And therefore, I thought it would be very useful because it helps rationalise why system dynamics is beneficial to sort of demonstrate some of the simple concepts of system dynamics in this learning tool. And part of the reason of this is sort of some of the decisions that you can make are maybe not always as intuitive. Like some things are intuitive, but actually when you consider them all individually and then combine them, this then results in quite a lot of complex behaviour that you may not necessarily expect. So it's quite a good thing to have a system dynamics model that might make you more aware of maybe the consequences that could potentially happen. So another thing is I really wanted to demonstrate the benefits of using system dynamics. So I felt, and especially in relation to the NHS as well. So I decided to achieve this by integrating an example of a system dynamics model into the tool, where essentially users will be able to coordinate 2 policies, and you'd have to try and hit 2 targets that are NHS based or have been recommended from the people, sorry. So by demonstrating this with an NHS applied example, I was hoping to effectively demonstrate how it can be used, while also allowing users of the tool to sort of consolidate those simple system dynamic concepts as well. So just general for the session. So it's not going to be a complete presentation. There is going to be interactivity, so I'm just going to put that out there now. So first of all, what we'll be doing is I'm actually going to walk you through the tool, because I thought the best way to learn about system dynamics and also showcase what I've done is to just go through the tool. So we'll all go through that together. So initially the use of it would be something that you'd sort of be doing independently, but how I'll do it is I'll sort of read out the text that's on the learning tool so we can kind of do it all together. And this is where the learning tool will be accessed from, and I'll be sending a link just after I've stopped sharing my screen, so you can also follow along if you would like. And you'd also need this link for when we do another portion of it a bit later, which I'll explain in a bit more detail. So also there'll be opportunity to be also answering questions. So you've already done one question on the Mentimeter earlier, which was about your skill set. And we'll also be doing a couple of questions which are in the tool, which we'll actually be doing in the text chat. So we'll just kind of give like A, B, and then you can react hopefully to if you think the answer is A or if you think the answer is B, and we'll just go with the majority, and I'll just guide us through the tool through the majority. So whether we get the feedback or whether it's correct, we'll do it based off that. And you'll also we'll have another question with Mentimeter later, and that will be in terms with an interaction with the simulator. So the simulator is the model that I've put into the learning tool, and essentially you'll just be coordinating those 2 policies, like I said earlier, to hit 2 targets. But when I go through the learning tool, don't worry, I will give an explanation as how to interact with it. There is a navigation tool to show you how to do it, but we'll go through that as a group. And then it'll be a case of it'll be a bit competitive as well, because we'll try and do it so whoever can. Oh, am I cutting off a little bit?
No, I just chuckled. Sorry, I'll mute myself.
You did.
People like a bit of competition.
Yeah, so it'll be a bit competitive, and yeah, we'll get into more detail as well when we hit to that section. And then lastly, we'll just end with a Q&A session. So I will just stop sharing my screen.
I've got the link here if you'd like me to post it, Scarlett.
Oh, yeah, of course. Yeah, no, that's.
And obviously, let's try all not to skip ahead and see the answers, but
yeah,
honesty packed.
yeah, that's very true. Actually, just before I do start sharing my screen on the learning tool, just does anyone have any questions so far, just in what I've spoken about recently, or just about the learning tool in general? We are going to have a Q&A session later, but I just thought if like a minute question here or there, quite happy to.
Don't have any questions in chat.
Okay.
And comment from Nicholas. Yep. Understand the ideas but haven't made model yet, so I think a lot of us, this might be a good introduction into what the models can do and playing around with it and stuff.
Yeah. Okay, in that case I will load up the learning tool. So okay, so this is the learning tool. It can be accessed by most people, so you should be able to all access it, and it shouldn't have an issue. So to start off, this is just the title slide, and to start it off, you just let's go. Okay, so first of all, you come to a tutorial about how to navigate around the tool. For the case of when you're navigating the tool later, when you get to the interactive simulator portion, I will just very briefly go through this. So it starts off, there will be next buttons, normally in this bottom right hand corner, and that will allow you to move on to the next slide. For each section, you'll also have sort of these points that will kind of show you what, so for example, when it is a black circle, that demonstrates what page you're actually on. So you can also use these to sort of navigate around. So for example, I could go page 1 and go back. So if we then go on to the next page, and there's also tabs. So this allows you, so for example, if you wanted to refer back to any of the information, if you wanted to cover concepts again, you can just go straight to that concept and you don't necessarily have to go through the tool. So it allows you to kind of skip sections and just make it a bit more of a more useful resource that you can refer back to. And in particular, this will be important when you just want to skip straight to the interactive simulator that we'll get onto next later. So we'll go on to context. Right, so to begin with, I just give an overview of firstly what you'll be doing on the learning tool. So it's to develop a better understanding for how and why complex connections across your healthcare system can lead to outcomes you may not have expected. To also see the real world application of how system dynamic modelling can be used to predict and plan services. And also I just gave a brief overview of the benefits of what system dynamics can offer and how engaging with it can, help your own services. So sort of being aware of how and why unintended consequences may occur, knowing when to coordinate multiple resources across time. So this can help with managing your resource and preventing sort of resource waste, and also just better planning across time will lead to better outcomes across the whole system and provide new areas where healthcare spending could also potentially be reduced. So it's just a general sort of list of benefits there. I then introduce you to the learning tool. So essentially it's the premise of that learning tool is to guide you through concepts of system dynamics and by getting you to role play as an integrated care system leader. And if I just take you actually to the bottom of this, so this bit, these are the 3 concepts that is covered in the tool. So the first one is delay, and that's how things can take time to change, and from this like delayed reaction due to how things are connected. Feedback is how something initially can cause a reaction in something else that then returns a reaction back either directly or indirectly through a chain of events. And then also unintended consequences, and these arise from essentially a combination of sort of delay and feedback and a few other concepts, but for the premise of this learning tool we're just focusing on those 2 and how that can make complexity that you may not have been able to sort of predict or intuitively come to. So the mission. So how I decided to create the learning tool around is I wanted to create a model that people could interact with, and I decided to actually focus on a dementia care pathway model. Part of the reason I did that is I wanted this to be based off open data, and there is a lot of data surrounding dementia. So I just felt that this was a really good opportunity to develop a well-informed model that is sort of reliable on some sort of realistic or relatively accurate statistics. Also, dementia is like an issue and a problem within the NHS that I think a lot of people are very aware of and also are relatable to. So I just felt it was a good topic to sort of cover, and it tends to be a disease that people are familiar with. This just introduces to your mission. So the focus is the dementia diagnosis rate. So the dementia diagnosis rate is the percentage of people with dementia who have been diagnosed over the total estimated amount of people with dementia. So your first target is you want to increase this dementia diagnosis rate to 66.7% over the next 2 years to hit national target. But currently you are actually forecasted to hit 65.1%. However, dementia diagnosis rate is not your only target. There's also a second target, and this is the dementia care pathway waiting time. and you want this to relatively be maintained around 6 weeks for the duration of the 2 years. And this is just because in this particular ICS, they've managed to get it down to 6 weeks, so they don't want it to then go back up. They want to, maintain it. So now you know the targets, we're going to go through the concepts of system dynamics to help you hit those targets. So first of all, what is delay? So to explain delay, I'm going to walk you through the impact of a dementia awareness campaign. So if we can increase the dementia diagnosis rate by increasing the number of individuals diagnosed, and a dementia awareness campaign achieves this by increasing referral rates to memory clinics. So this is where the first question comes in. Do you think a dementia awareness campaign will increase referral rates straight away? So Edwin, are you okay to put A, B into the chat?
Yeah, I put those in the chat. So if you want to vote on one of those, just like it, or put an emoji next to one of them.
You can use whatever emojis you want. We'll just be counting. If you just want to.
Oh, we're getting a mix. That's it. That's good.
Okay. I'll be honest, I can't see the chat, Edwin, so
yeah,
I'm going to have to rely on you.
Yeah, we've got a laughing emoji. That's good. Got 14 for no, 9 for yes. So it's actually quite even.
Okay.
It's going up for no, but let's give it a few more seconds.
Okay.
I'm just going to see how many people in the room, because actually I've got about 45 in the room. So I think got quite a few number of votes. I think at the moment no is winning. 17 emojis, including one laughing emoji, and then yes has 10. So no is one, I'd say. It's pretty clear.
Okay, no. So let's go for no. Oh, there we go. Yeah, that is correct. So referrals will not be affected straight away. So then you get an explanation. So the reason this is the case is dementia awareness campaign, and just on this graph, this is the duration of the dementia awareness campaign. So you can see it starts here and this is where it ends. It will not increase referral rates straight away, and that's because there is some delay. So the reason this can be is it does take a while for people to become exposed to awareness campaigns, and also a while before the right individuals are exposed, and also a while before they respond to the campaign and do something about it. So you kind of got many different barriers that people might have to be dealing with themselves to, take the action and actually respond to it. So there is always a little bit of delay. So the next question is, what do you think will happen to the referral rates immediately once the campaign ends? So either A, do you think the referrals will continue to increase, B, that they level out, or C, that they then begin to decrease?
Okay, just posting in the chat. I need to get C in there. I need to get C in as an option. So all three options are in there now. A is running away. Maybe that's why I posted it first. I don't know. But by the way, we really welcome your feedback at the end of this, just on the wording and, if the questions are clear, if you agree with the answers. So this is obviously a sort of tool that we really welcome feedback on.
Feedback is good.
Human behaviour is complex. It definitely is, and sometimes not clear cuts. So okay, in terms of results, oh gosh, I'm getting strange figures here. I don't know if that says 13. It's just I've never seen a varied number of emojis. It's squashing the numbers.
I think it is 13,
looking like fractions. I think 14.
Yeah, because if you hover over it, it's got a long list of people's names.
We've got a rainbow of emojis. It's amazing.
Nice.
Including one angry.
Who angry?
Just disliking that answer. So, well, the winner is A, just in terms of number of emotions shown for that one.
Okay. Right. Okay. So we'll click A. Yeah, that is correct. So for the explanation of this one, so once the campaign stops, the referrals will continue to increase, again, because of delay. For example, this might be because it can take time for close acquaintances to convince their loved ones to seek help. Additionally, also, as an awareness campaign goes on, the pool of people that are sort of most susceptible to the campaign will grow. But once the campaign stops, the growth of this pool will then slowly stop, and the pool of people will then begin to shrink as people refer themselves for a dementia diagnosis. So once the pool of people shrinks small enough, referral rates will then begin to decrease. So you kind of end up with this sort of increase and then a collapse, and sort of returning relatively to normal levels. Right, so that is the concept of delay. I'll just go on to the next concept, which is feedback. So before I go into feedback, I just want to visit what the dementia care pathway for this integrated care system is like. So you start at triage. So this is where individuals present at primary care and are then triaged on if dementia is suspected. They then are referred to a memory clinic, and the memory clinic receives this referral, and then the clock starts for the dementia care pathway waiting time. And at the clinic, individuals can undergo a series of tests to then receive a dementia diagnosis. Now, some individuals will actually be referred on for imaging scans before returning to the memory clinic for a diagnosis. And also, you kind of essentially have two pathways. So you have people go from the memory clinic to getting their dementia diagnosis, or from the memory clinic being referred on to imaging scans and then referring back to the memory clinic before their dementia diagnosis, just as a summary through the graphics. So individuals are then diagnosed and a dementia care plan is devised, and this is when the dementia care pathway waiting time stops. So an example of feedback that exists in this pathway is if more patients are referred to the memory clinic, the number of individuals on the waiting list will increase. This means more capacity is required to ensure the waiting list doesn't grow. Once the capacity has increased, this means more people are seen at the memory clinic, and if more people are seen, then the number of individuals referred onto diagnostics will increase. As more individuals are referred onto diagnostics, more people will return and be referred back to the memory clinic. And this is known as a positive feedback loop, because an increase in referrals ended in an increase in referrals. And also, just as an example, if through the loop we ended with a decrease in referrals, this would then be called a negative feedback loop. So on to the question, which one of these options do you think is not a feedback loop?
All right, okay. You know the drill by now. This is the last one we're going to do in the chat. It's very popular. Yes. So A or B, very simple. Got one for B there, first out the gates. Let's see. People are having a little think and a read of that, to be fair.
Yes, a little bit.
Good to have a think first. More laughing emoji coming. So B is the only one getting votes so far.
Okay.
And yeah, 8, 9, 10 votes. One shocking. Going up. No, none for A. Or A.
Well, I mean,
that's fair enough. Well,
yeah, it might be the right answer.
It's looking decisive, yeah. Just to be nice, you don't have to say the wrong answer just to be nice. Okay, it's convincing. I mean, it's I don't know if it's convincing, but it's definitely decisive.
Yeah.
So I'll pass back to you. Is it B or A?
Well, let's find out. So
let's click on B. The vote.
So well done. This is not a feedback loop. So this is not a feedback loop because the output is not affecting the original input. An increase in individuals over the age of 65 is not influenced by the demand of people requiring dementia care. It's essentially influenced by the population demographic and obviously other factors, but the majority of that. And in fact, the demand of dementia care can be fixed by how many individuals over the age of 65 exist within the population. And therefore, this is just a chain of events where the input can only influence the outcome. Now, I'm actually going to go back to the other feedback loop. There we go, showing the navigation of the tool. So I just wanted to ask for A, does anyone have an idea of whether this is a positive or a negative feedback loop?
invite people to raise your hands if you're brave enough to.
Yes.
If you want to have a guess, or we have also comment. Negative, someone said. Thumbs up. Thank you for that.
Thank you. Yeah. So this is a negative feedback loop.
Yeah.
I just wanted to. Sorry.
Yeah, we've got a few comments saying negative. So yeah, that's right.
Yeah. So this is actually a negative feedback loop with some delay. So just wanted to demonstrate here how they can be combined. It's not all just a feedback loop. You can get feedback loops with delay. You can also get longer feedback loops, for example, and that can also create some sort of complex behavior. So in this case, it's a feedback loop because the output affects the initial input. It's negative because you have an increase in referrals that results in a decrease in referrals through the chain. And it's also a delay because there's a decrease in the number of individuals undiagnosed won't cause a decrease in referrals until the pool of undiagnosed individuals reaches this sort of small amount. So I just wanted to just refer back to that just to show the extra side to that. Right, okay, we'll go on to unintended consequences. So unintended consequences can occur when we sort of mostly focus on one goal and we're not aware of what and how things are interacting. For example, if you only focus on increasing the diagnosis rate to 66.7%, you may accidentally neglect the 6-week target for the dementia care pathway waiting time. So we're just going to simulate what an awareness campaign for 20 weeks would look like on these targets. So the dementia care pathway waiting time of 6 weeks is just not maintained. The dementia awareness campaign increases referral rates, which increases the weekly memory clinic demand above their weekly capacity. And if each week more people are referred than being seen, the memory clinic waiting list will grow and the waiting time increases. Also, the dementia diagnosis rate reaches only 66.1%, so this is not the 66.7%. So a high dementia care pathway waiting time can actually negatively impact the diagnosis rate. For example, a high waiting time will reduce individuals' engagement with getting a referral, which will reduce the impact of the awareness campaign. But also secondly, at some point, increasing the length of the dementia awareness campaign will actually no longer have an effect on that diagnosis rate. And this is because people get stuck in the pathway. There is a backlog and this sort of limits the number of people being diagnosed weekly. So we're now going to go on to the interactive simulator. So I'm just going to do a walkthrough just to show you how to sort of use the interactive simulator, and then it'll explain the task, and then I'll then let you guys all have a little interaction with it and we can have a bit of a competition. So first of all, you are provided with 2 graphs. One of the dementia diagnosis rate and one of the dementia care pathway waiting time. So from week 0 to 104, this is historical data. And then week 104 to 208 is simulated data. So there is a switch to turn on the awareness campaign, and in this case, the switch is already on. So you can also click on recruiting workforce, and this enables you to recruit an extra team to deal with that extra demand. So you can click like that. So as you can see, that's off and then that's on. By sliding the first notch of the sliders below, you can alter when the awareness campaign and extra recruitment period starts. And then by sliding the second notch of the sliders below, you can alter when the awareness campaign and extra recruitment period ends. So I'll just demonstrate here. You can move these like this, and you can alter when it happens. You can press the run button, and this will run a simulation. So if I press to run a simulation now, it changes the graphs. When both the awareness campaign and extra recruitment is on, you will tend to get a value here for the total time for how long both policies have been enacted for. So now I'll just outline the task at hand. So essentially the task is to hit both targets and find the minimal amount of time that policies need to be enacted for. Your first target is the dementia diagnosis rate to reach 66.7% by the week 208. And the second target is for the dementia care pathway waiting time to remain around 6 weeks from week 104 to 208. And there's an orange area on the graph to roughly sort of highlight this area. So if you hit a target, a green tick will appear next to it. And if a target is not hit, a red cross will appear next to it. So you can see here there's 2 red crosses, meaning that both of the targets haven't been hit at the moment. So now you know the task, you can now attempt to achieve your targets. Okay, so this is the interactive simulator. So what we're going to do is you can all have access, if you can all click on that link that Edwin sent in earlier to the learning tool. What I would suggest to do is, so if you get onto that first page and you press let's go, and then skip the navigation tool, you can go straight to the interactive simulator tab. So you can click the tab on the top here, and that should take you to where you're either on the navigation tool or the task. If you hit the task, you will first be reintroduced to that task. So it will just take you through what each of the targets are, and it's only when you get to proceed to the interactive simulator that you're on the actual interactive simulator page. So to make it competitive, if I could just ask people to fix this 124. So when you run the awareness campaign, you can move this one as much as you like, but just keep this 124 here, just because it will be easier for us to make it competitive and see what solutions everyone gets to. We're thinking of maybe giving people up until 20 past 3, if that's okay.
Yeah, that sounds great.
And also, if you want to just have a little look through the tool, you're more than welcome to do that in that time as well. So, I mean, I'll just do a little random run. I will stop. Should I stop sharing my screen? I'll stop sharing my screen for the moment.
Thank you, Scarlett. So yeah, people have started with 124, and so we got quite a range. Quite a big range.
Yeah.
Am I reading that right? 1,462. I don't know if that's a typo. Maybe 146. Not sure if it went up to that high, but I'm assuming that's 146. But that's just really interesting because a lot of people are saying 145, 146. Yeah. That's really interesting.
Liz, have you got a question?
Yeah, sorry. It's probably I'm muted on chat, so you clearly know that I'm a little bit out of hand. So I do apologise. I would normally have just chucked it in the chat. I've got 160 and 190, by the way, which is obviously a bit random compared to everybody else's. But I was interested in the calculation for recruitment. So what did you use? Because I always go on the fact that it takes so long to recruit somebody, and so you build that into your sort of calculation. So I was just interested what you used.
So again, initially it was more complex than it was. So I did an actual general, I think it was, I'm just trying to remember what those numbers were. I think it was 18 weeks, but I then put that to, it's 18 weeks, is that about 6 months? I think it was about 18 weeks. And then I had to, but how I did it is I actually did a slow recruitment initially. So it wasn't that you just recruited the whole team straight away. Because of the behaviour that was being created through that, I felt it was more simple to just do it, that you recruit the whole team and they work at that whole point. And that was just, so it was kind of a sudden, it was more like the team had been recruited and then they were placed in, and that's when they function, they can take on those extra appointments. And I think that was left at, I think it was 3 months. So that would have been 12 weeks.
Brilliant. Thank you. Thanks.
So we have one very brave soul, Hamza, round of applause to you for sharing a snippet of your screen. I know sometimes in the NHS, I mean, maybe it's a universal thing, but people can be quite nervous to share their answers, afraid of being criticised. We really advocate the opposite of that approach. Is, you know, it's not about being right or wrong. Actually, there might be multiple optimal answers in this scenario. It's more about, can you talk about why, the rationale, like trying to understand the causal loops, the causality between what's going on in the complex system. So thank you for both for sharing. I actually got quite different answers there, 2 different answers. See, this is why there's, you know, as a former economist, multiple equilibria, or whatever you want to call it. That is so interesting there. And I don't know if anyone, James or Hamza, if you want to comment on the rationale, because there's quite 2 different answers there on the recruitment, which if you're, you know, no pressure, because you've done a great job just already sharing the snippets. But yeah, anyone is welcome to come off mic. We've got a hand raised. Sorry, I didn't see that. Hamza, please feel free to come on mic.
Right, I'm happy to bite the bullet and see how this one goes. There was a little bit of playing around with it, I won't lie, but I think for me, trying to figure out how long I would normally recruit someone for, which would, I guess in totality, would hopefully be about 3 to 5 months-ish. And I figured for the time period it's going for, it would start sort of around the same time or a little bit after that campaign, looking how the diagnosis rate was going. If it's not going to hit 67 for a while, you could kind of delay that a little bit after that began. So I tried to position it sort of around that time when it was just about 2 months, I think, or maybe 3 months after, and then have a go with a week here and there and see what happens.
That's really great. Thank you so much. And if you wouldn't mind asking, do you work in ICS, or what kind of role do you work in? Just curious.
I am regional for NHS England.
Okay, cool. Because I think we might come on to that, but it'd be great to get feedback about this tool as well. But Scarlett, I'll pass back to you. I can stop sharing my screen. Thank you so much for everyone submitting the answers there.
Yeah,
it's really interesting.
Yeah, no, it's interesting. It's nice to see that a lot of you are grasping the concepts, and you have sort of seen the key things that we're trying to get across in this tool. So I will just share my screen and I will get it back up. Right, so what I will just give you an example answer, which I believe is there. And I think actually someone did get the same as what sorry, I think it was there. I might be slightly wrong. One sec. Oh, it's taken a while. I mean,
it's always the case, isn't it?
Technical issues, isn't it? Wait, I'll reset my I'll reset the screen and then I'll try it again. Okay, put those back in. So yeah, I think that was one up than it should. No, I think it's one less than that. No, I haven't got that on. Well, now you can see the big difference of what it does. Oh, that's embarrassing.
Well, it's only slightly out. But it's interesting. Yeah, I think everyone's answers is sort of, there's that delay concept in there, isn't there? With the
yes. So yeah. So there's an example solution, which I'll just go very briefly through, because it also just explains, for example, there's not an optimal solution. So I've provided here an example solution, and the reason there's not an optimal solution is, well, in our case there was, because we fixed that 124, but you could move that along, and that would impact what your recruit for extra workforce is going to be at, like you said, with the delay. So I will just skip over this because that just gives the very brief solution that I just gave, and onto the explanation. So to provide an explanation, we're going to look at the dementia care pathway waiting time, and the memory clinic demand and capacity. So, and the duration of the awareness campaign is just highlighted in blue on these graphs. So the start of the recruitment will have to happen after the start of the awareness campaign, and this is because there is a delayed reaction before the awareness campaign affects referral rates, and that was previously explained in the delay example. So the first peak in the dementia care pathway waiting time. So this actually happens because it takes a while for the workforce to recognise an increase in demand to then adjust their capacity to the highest level. And getting used to sort of a new team and adopting to it. That's what that kind of represents, and that was put into the model. And as demand increases steeply, the delay of the workforce capacity is starker, and so hence we kind of get this peak in waiting time. And then the second increase, there is a point where the memory clinic demand lies above the highest capacity level. And this causes a second increase because more individuals are being referred than are being seen by the memory clinic, and hence the memory clinic waiting list grows and the waiting time increases. So that's just to give a sort of a brief overview to why that happens. And you're right in the sense that it takes a while to recruit that workforce, and therefore you need a bit of delay. But also the awareness campaign, there's also delay there. So your referral rates will sort of increase, and that's when you want your extra team to be recruited for to deal with that extra increase in referrals. So that's the end of the learning tool. There's just a brief summary about just a reminder of what delay, feedback and unintended consequences are. I hope that you have learned something. If not, from the day, been able to consolidate some information, but also, have a bit of a play around and a little bit of a difference to the pace of the day, I hope.